Pregnancy is the remarkable time during which a baby develops inside your uterus. It typically lasts about 40 weeks, beginning from the first day of your last menstrual period. These 40 weeks are divided into 3 stages known as trimesters. The first trimester spans approximately 13 weeks. Interestingly, during the first 2 weeks, you aren't technically pregnant. This is simply how your due date is calculated. However, your body is already preparing for pregnancy. In the second week, an egg is released from your ovary in a process called ovulation. Around the end of this week, conception, also known as fertilization, occurs when a sperm from the father successfully merges with the egg from the mother, typically within the fallopian tube. At that moment, genetic material from both parents combines to create a completely unique genetic code. This single event instantly determines traits such as your baby's sex, hair color, eye color, and hundreds of other characteristics. The newly formed single cell, called a zygote or embryo, marks the very beginning of a new human life. By the 3rd week, the zygote rapidly divides, forming a hollow ball of cells known as a blastocyst. These cells begin to organize themselves into 2 distinct groups. The inner group will develop into your baby, while the outer group will form tissues that will nourish and protect it throughout pregnancy. In the 4th week, the blastocyst travels into the uterus, shedding its outer layer in preparation for implantation. Once free from this layer, it embeds itself into the thickened uterine lining, a crucial step known as implantation. Weeks 5 through 10 are referred to as the embryonic period. During this stage, all of the baby's major organs begin to develop, including the brain, spinal cord, and heart. The tiny heart even starts beating during this time. The placenta and umbilical cord also form, creating a vital lifeline that delivers nutrients and oxygen from mother to embryo. Bones and muscles begin to take shape beneath delicate, translucent skin. By the end of the embryonic period, the embryo has started to look distinctly human. By the end of week 10, the embryo officially becomes a fetus, measuring about 1¼ inches from head to rump. Over the following weeks, the arms and legs grow longer and begin to move. Fingers and toes fully develop, and your baby's face takes on a well-formed, recognizable shape. By the close of the first trimester, your baby is nearly 3 inches long. Throughout these early weeks, your body undergoes significant changes, driven by shifting levels of hormones circulating through your system. The most common first sign of pregnancy is a missed menstrual period. Alongside this, you might experience nausea, commonly called morning sickness, which can actually occur at any time of the day, tender, swollen breasts, mood swings, constipation, weight loss or weight gain, food cravings or sudden dislikes for certain foods, increased fatigue. Some women experience only a few of these symptoms, while others may not experience any at all. If you have questions about your baby's development or concerns about how you're feeling, it's always best to speak with your healthcare provider. The first trimester is one of the most crucial stages of pregnancy. This is when your baby's major organs are forming, making it essential to avoid taking any medications without your doctor's guidance, as certain medicines can affect your baby's development. One of the most common symptoms during early pregnancy is nausea. Many patients tell us they feel nauseous throughout the day, struggle to eat, and sometimes experience vomiting. In many cases, this is a normal part of pregnancy and doesn't require treatment. We usually recommend eating foods that don't trigger nausea. These preferences can vary greatly from person to person. If a patient has only 1 or 2 episodes of vomiting per day, treatment typically isn't necessary. However, if the vomiting is constant, preventing her from eating or even keeping water down, causing weakness and dehydration, medical intervention becomes important. In such cases, we prescribe safe, carefully selected antiemetic medications tailored to individuals' needs, ensuring they can be used safely during the early months of pregnancy. It's important to remember that experiencing nausea or vomiting during pregnancy doesn't mean you're sick. It simply means you're pregnant. This is a natural part of the journey. Pregnancy is not an illness. It's a normal, beautiful phase of life meant to be embraced and enjoyed. If you're working, continue your job as normal. If you're a housewife, stay active around the home. Bed rest is not necessary unless specifically recommended by your doctor. The key takeaway is to stay active throughout your pregnancy. If you already have an exercise routine, discuss it with your doctor to ensure it's safe to continue. Most exercises are perfectly fine, but we do advise avoiding contact sports or activities that carry a high risk of falls or trauma. One essential supplement during this stage is folic acid, 5 milligrams, which should be taken daily. This crucial vitamin helps prevent malformations in your baby's brain and is a cornerstone of a healthy pregnancy. For women managing existing conditions such as thyroid disorders or high blood pressure, it's vital to consult your doctor and continue prescribed medications as directed. By following these simple but important tips, you can navigate your first trimester with confidence and ease and truly enjoy this incredible chapter of your life.